Hi there, and welcome to your pre-op nutrition class. We look forward to helping you. During this pre-op nutrition class, our goals are to help you understand the anatomy of your new tool, anticipate common pitfalls after surgery, learn about the perioperative process, establish techniques and good habits to ensure long-term success for the rules of the tool, and learn which foods will best serve you and your specific needs to accomplish your goals. You may be asking, so what's different about me after surgery? Well, with the sleeve, bypass, and duodenal switch as well as the band, your stomach size is significantly reduced from 40 to 60 ounces to just 1 to 4 ounces. With the bypass, your outlet of your stomach is changed. With the bypass and the duodenal switch, your small intestine food path is shortened, and this may reduce nutrient and calorie absorption. And solid food may take longer to empty, which creates fullness. Also, your hunger hormone is greatly reduced after the bypass, duodenal switch, and sleeve. These are examples that your surgeon has gone over with you of the gastric sleeve, the duodenal switch, as well as the gastric band, so that you know what to expect with the anatomy changes that you will be having post-surgery. As far as your pre-surgery shopping lists, we want to make sure that we're setting you up for success. Making sure that you have a multivitamin that's chewable or liquid, no gummies. Also, we want to make sure you have a B12 sublingual that goes under your tongue and dissolves completely, or a nasal spray, or you can do an injection with your doctor. Also, you'll want to pick up some 4x4-inch gauze pads and paper tape for your incisions and covering those after surgery. You'll be wanting to pick up clear liquids because you will be on a clear liquid diet prior to surgery. So examples of clear liquids would include broth, tea, herbal teas, diet lemonade, non-carbonated, non-caffeinated drinks, also sugar-free popsicles, sugar-free Jell-O, clear liquid protein drinks such as Isopure or Premier, or if you have an alternative protein drink that is clear that you want to use prior to surgery, please make sure that you're reviewing that with your registered dietitian. Also, you'll want to make sure you have protein powders and shakes for after surgeries that are low in carbohydrates and adequate in protein. Once again, review this with your registered dietitian to make sure it fits your nutritional guidelines. When you're choosing a protein supplement, you can choose powdered or pre-mixed. Those are both acceptable. The key, though, is to try and make sure you like it before surgery. Also, look for at least 20 grams of protein per serving and no more than 5 grams of carbohydrates per serving. You can use water to mix it with, non-fat or 1% milk, unsweetened almond milk or soy milk, as well as Fairlife milk. Unflavored protein powders can also be helpful in using it in foods that may not give you adequate protein. So try out some unflavored protein powders to make sure that you're getting adequate protein in the meals that you will be consuming post-op. Another key for making sure that you're completing your nutritional goals after surgery is making sure you're maintaining your hydration. Not getting a minimum of 48 ounces of fluids can end up back in the ER or the hospital. The goal is really getting closer to 64 ounces of fluid every day, forever. Also, one big rule is after solid food begins at 6 weeks, we don't want you drinking and eating at the same time. You can separate your meals and drinks out by 30 minutes before and 30 minutes after, but no food and beverage at the same time. I know this is a new habit for most of you, as we typically are used to drinking with our meals, but this is something specifically required in order for you to make sure you're really receiving the benefit of feeling that fullness. Also, liquids should be low to no calorie, which means 15 calories or less for the beverage. And we really want you to stop drinking at least 15 minutes before eating and 45 minutes after. That is ideal. There are great apps out there to help setting timers so that you're used to that, and also talking to your support group about that, because once again, this is a behavior change for you. Post-surgery vitamins and minerals. We want you to make sure you're taking a multivitamin every day, and that's twice a day for bypass as well as duodenal switch. B12 daily, which is 1,000 micrograms, once again, sublingual, nasal, or injection. Once again, calcium citrate. This is something we want you to add after surgery, And we really want you to take around 1,000 to 1,200 milligrams per day. But we do want you to break it up into 500 milligram increments. That means you may be taking 500 milligrams at breakfast, 500 milligrams at lunch, and another 500 milligrams at dinner. Fiber is also very important in your bariatric diet because you are restricted in the volume in which you typically consume. So around 6 weeks, we actually want you to start taking a fiber supplement. You can ask us if you have specific questions about brands that you want to try, but there are several brands out there that are powders that you can add into your foods or into your drinks. You may also need to take iron. We recommend ferrous fumarate. Other sources of iron can be very constipating. And if you have the duodenal switch, you also need to take your fat-soluble vitamins, which are A, D, E, and K. Lastly, biotin. We want you to take 5,000 micrograms per day, which can help with hair regrowth. We know that sometimes you lose hair after surgery. You won't be going bald after surgery from the procedure, but we want to make sure that you're getting those adequate nutrients. So once again, this may help. Also, many of you have already been working on this, but just as a reminder, we don't want you frying anything after surgery. We want you removing visible fat from meats prior to cooking and adding no calories to the cooking process, such as butter or oils. Our preferred method of cooking is going to be baking, broiling, poaching, barbecuing, crock pots, etc. The one thing about crock pots, though, is we don't want liquids with meals. So once again, it needs to be bulky versus a liquidy meal. Choosing your protein sources. So low-calorie proteins will be things with less than 10 calories per gram of protein. Those are foods that you should be eating most of the time. So if you're looking at your food label and the food item has 200 calories in it, you're going to want to make sure it has at least 20 grams of protein to be considered a low-calorie protein choice. A moderate calorie would be between 11 to 19 calories per gram of protein. You should be only choosing those occasionally. And high-calorie protein choices that are things such as greater than 20 calories per gram of protein, we only want you choosing once to twice a day. We'll be going over these so you have a better understanding of the food choices that fall in these categories, what to be consuming more often than not. So once again, the rule of 15. For every 15 calories you consume, it needs to have at least 1 gram of protein. Second rule, no more than 15 grams of carbohydrates per meal. This is especially important for those of you that may experience dumping syndrome. Third rule is aim for at least 15 grams of protein per meal. These are great rules when trying to buy things like protein bars. Low-calorie protein choices are going to be things like fish, shellfish, dairy, such as low-fat cottage cheese, Greek yogurt, low-fat mozzarella string cheese, also poultry, lean beef, lean pork, egg whites, egg substitutes, and tofu are all considered low-calorie protein choices. Medium and high-calorie protein choices may be things such as nuts and seeds. Once again, these are good nutrition, but we don't want you consuming them as frequently as the previous slide. Also vegetable proteins such as beans, high-fat pork such as bacon, sausage, and ham, high-sugar yogurts, which may be your fruit-based yogurts, as well as soft cheeses and whole eggs, all fit in this medium to high-calorie proteins. White carbohydrates are a no-no, such as popcorn, pastas, potatoes, white breads, white rice, and refined sugar products. I know you may have heard this before, but once again, we really want to make sure we're setting you up for success. Some other considerations: always eat a little less than you think you need. You don't want to overfill your stomach because fullness can take up to 20 minutes for your brain to get that signal. And if you're overfilling yourself, you may actually feel sick. Once again, focus on lean proteins and low-fat dairy. Fruits and vegetables can be added back in around 3 weeks. And we really want you to limit soups as well as salads. Once again, those liquidy meals such as soups are just going to slide right through. And salads, we really want protein to be your primary focus, especially after surgery, since your nutrient needs for protein are significantly higher and can be somewhat challenging with your volume restrictions. So prior to surgery, what we can do to set you up for success is we want you to start cutting back and doing small, frequent meals. That means 5 mini meals a day. Cut down on the carbohydrates. Begin an exercise routine. This is really important. Exercise is really going to help you keep your weight loss off. Start taking your vitamins. Experiment with different protein shakes and learn which ones you like before surgery. Practice taking smaller bites and chewing your food well. We always say chew your food about 20 times before you swallow, and take pea-sized bites or pencil eraser-sized bites. Sometimes my clients have used things like appetizer silverware or baby spoons to help keep those serving sizes small. And we really want you to reduce the caffeine and alcohol intake, as well as make sure you stop smoking. There are 4 parts to the tool: the diet, the exercise, the tool itself, which is the surgery, and you. And your surgery is the tool. But once again, we know that behaviors are really hard to change, and we're here for you, and we strongly encourage that you use us to support you in this. Some of the rules of the tool that you want to keep at the top of your mind are: we want you to make sure you're getting 75% of your diet should be from protein and 25% from complex carbohydrates. So if you were to fill up a measuring cup with protein as 3/4 of the way full, and then fruits and vegetables as the last quarter, that would be an example of how your diet should look. Once again, 75% protein, 25% complex carbohydrates. Not simple. Simple are those things that we really want to avoid and make sure you're limiting. We also want to make sure that you focus on 5 to 6 protein-rich meals per day. That means eating within the first hour or so of waking up and every 3 hours thereafter. I know this may be an adjustment for many of you, but once again, it's really going to help you achieve getting your nutrition in and that long-term weight goal that you really want to succeed in. You need to eat within the first hour of waking up and within the last hour before going to bed. And that will help you to get in the minimum protein goal. The volume really depends on you and your specific surgery. So you want to listen to those satiety signals, and once again, that can take a while for you to understand how easily you can get full. So stop eating before you're actually full, because you may feel overstuffed. Also, avoid protein drinks after solid food begins. Usually around 6 weeks, we ask you to cut those protein drinks off. So clear liquids are right before surgery. Protein drinks are encouraged for the first couple of weeks after surgery until you're actually meeting your protein needs from food. And then once you're able to do that, we encourage food over those liquid protein drinks. It's okay for you to use protein bars every once in a while, but it's not a strong encouragement that you're using them frequently. So once again, we say choose those very sparingly and make sure you're picking them out based off of that rule of 15. No more than 1 cheat per week. We understand this is challenging, but at the same time, we really want you to be successful. So plan your cheat out in advance and stop and think before you eat it. Is this worth it? Is this something that I really want to do? Knowing that my goals for long-term health are something that should be my primary focus. The rules of the tool for exercise are a minimum of 5 times a week for at least 30 minutes. Start trying out different exercises that you might be able to do. And I always encourage my clients to focus on what they can do instead of what they can't do. We all have exercise limitations, but find something you can do. Even if it's lifting light free weights or doing some type of resistance training, an elliptical, recumbent bike, swimming, these are all great things for you to start working on incorporating into your activity regimen. We also want you to make sure that you don't do resistance training for the first 6 weeks, as well as swimming. You need to be cleared by your doctor to reincorporate those right after surgery and wait that 6-week period before re-engaging in those type of activities. We strongly encourage changing up your activity routine every 8 weeks so that you don't hit a plateau. So you can start thinking about the frequency, intensity, time, or type. Meaning that you might change out how long you're going out for that walk. And maybe it's instead of 30 minutes, maybe it's a beautiful day and you want to go for 40. You can change the type. So maybe instead of walking, you might try walk and jog or elliptical. You can change up the intensity by taking a hillier route or really bumping up the incline on your treadmill. And the frequency. So maybe you started out at 3 days a week, but now you're ready to take it to 5. These are all great ways of changing it up so that you don't hit that weight plateau that you dread. And the rules of the tool. Well, once again, that tool is your surgery, and that is that new piece that's really going to help you stay consistent. So use it and make sure that you're using us as well. Eat an adequate amount of protein so that you really stay full. Once again, 10 to 15 grams of protein every 3 hours. Do not eat to capacity or overstuff yourself, and listen to your body. We also want you to stay connected socially and online, so follow us on Facebook, as well as reach out to us and make sure you're attending the classes that we offer. Adjust your tool and yourself. So make sure that you're following up with your doctor as well as our office. Take advantage of the support groups that we have, as well as behavior modification. We know that behaviors are hard to change, like emotional eating, eating for stress, or eating for boredom. So once again, we're here to help you change those habits. We know there's a little bit of anxiety when we start to talk about surgery, and those concerns are normal. If you weren't anxious, I would actually be worried. You really want to make sure you're confident going into this, but some anxiety is a little bit normal, and it's a big step that you're taking. So the weeks leading to surgery, you're going to make sure that you're visiting with pre-op admissions, the pre-op nurse, and going over labs, EKG, and your pre-op admissions. You're going to make sure you do your pre-op appointment with your surgeon or nurse practitioner, and you're going to be given instructions, just as a reminder, on the diet. So 48 hours prior to surgery, you are on a clear liquid diet, as we discussed. Skin prep will be discussed, making sure you have those gauze pads and paper tape, and making sure you're not smoking or drinking alcohol. Your medications. We really want you to stop all NSAIDs or pain relievers 2 to 3 weeks prior to surgery. This includes aspirin, Motrin, Aleve, ibuprofen, and naproxen. Tylenol is now your new pain med of choice. If you have other pain considerations that are needed, once again, we ask that you discuss that with your doctor. For bypass, we don't want you swallowing anything bigger than the size of a pencil eraser, so no large capsules or extended release tablets. The size of your medications, once again, should be the size of a pea or a pencil eraser. And tabs should dissolve in 1 ounce of warm water over the course of 10 to 15 minutes to make sure you're getting the absorption of those prior to consumption. For hormone replacement therapy, we want you to contact your doctor, and no birth control pills or patch or NuvaRing for 6 weeks prior to surgery and 4 weeks after. You must use backup birth control for at least a year, because this is your year to focus on you and your health. So things such as IUDs, depot shots, implants, those are fine. As far as other medications, such as if you're diabetic, we want you checking with your doctor for blood sugar guidelines. We want to make sure that you notify your surgeon if your blood sugar is greater than 200 prior to surgery. And if you're on insulin, you need to talk with your healthcare provider about your plan before and after surgery, as this will be something that needs to be changed. If you have high blood pressure, you should also be checking your blood pressure regularly before and after surgery. And if you're on a blood thinner, such as Coumadin or Xarelto, you must discuss that with your healthcare provider when and how you stop that medication, and if you'll need Lovenox or heparin, such as an anticoagulant bridge before and after surgery. Your follow-up appointments. Each surgeon has a specific post-op appointment schedule, so work directly with that surgeon's office to schedule follow-ups. Stick with your appointment schedule, as it's important. Prior to discharge, make an appointment with your primary care provider for 1 week after surgery, and review your medications to manage your other diseases, such as diabetes, hypertension, and sleep apnea. And then once again, make sure you follow it up with those Rose Bariatric Center classes, such as support groups or in-person or teleconference or virtual conferences. Your hospital stay. So following pre-op instructions regarding your diet, you can bring with you your CPAP, your BiPAP, and your travel O2 tank. We want you arriving 3 hours before your scheduled surgery. There will be an IV that is started, as well as that fluid. We'll make sure that you're given antibiotics, as well as leg compression devices to help prevent blood clots. Heparin, which is an anticoagulant to prevent blood clots. And your family may be with you for most of the pre-op, but not surgery or recovery. Surgery typically takes between 1 to 2 hours, and recovery room you'll be taken to after that. You may have an additional IV or central line placed once you are asleep. 1 to 2 drains is typically common, and you'll have them removed prior to discharge. For some surgeons, they may place a G-tube. You may be on a pain pump or other local numbing agents, such as On-Q is typically placed during surgery and removed before you leave the hospital to control your pain. Activity. All patients are expected to walk 3 hours after surgery, so expect that your nurses will be up and bugging you to get up and get moving. Your hospital stay on day 1. So after recovery, about 1 to 2 hours post-op, during this time, your family and visitors can wait for you upstairs on the surgical floor. The surgeon will either see your family in person or call them. And some patients who need a higher level of care will potentially go to the IMC or the ICU, depending on how the surgery went and what their, once again, higher level of need may be. All patients have a pulse ox oximetry, or what's called a knock-ox study in the night, to determine their discharge for assessing oxygen home health needs. You'll also be given an incentive spirometer breathing device. We want you to use that hourly. Some patients have an upper GI if the surgeon thinks it's warranted. And for gastric band patients, they usually go home after recovery, after surgery, and they do not need to spend the night. Pain is expected after surgery, but you have several options available to you to manage this discomfort. So get up, get moving. That's definitely something that helps. Also, you'll receive a combination of non-narcotic pain options and a long-acting numbing medicine that will provide you with better post-op pain management. Some patients start on IV medications before transitioning on oral medications. Notice that the left side of your abdominal wall is commonly where your discomfort is felt, and that is normal. Some people report feeling regret or remorse for the first day or two, and that's normal too as stress hormones begin to rise. You have put a lot of effort in this process. Feel proud about your decision to improve your health and well-being. You will have a team of surgeons and dietitians to provide you with safe nutrition options. Once you're cleared to start drinking, which is about 3 to 4 hours after your surgery, you will start on what we call the bariatric stage 2 diet, which is 1 ounce of water every 30 minutes and 1 ounce every 15 minutes thereafter. You'll receive a tray of water, broth, sugar-free Jell-O, decaf tea, sugar-free popsicles, and protein drinks. These liquids are tools to help you meet your hydration needs. Once you're tolerating those well, you may be able to increase to the bariatric stage 3 diet. Add provided protein drinks, so 1 ounce per hour. Total fluid increase to 4 1-ounce portions hourly. IV fluids commonly continued the second day, and you're encouraged to get up and get moving 6 times a day. For gastric sleeve patients, you're commonly discharged on this day. On the final day of the hospital, that's when you're really taking those fluids well, and they may be capped or stopped. Once again, safe and independent discharge is something that we pride ourselves in. So continue walking and using that breathing devicing as well as coughing exercises. Continue fluids for the first week with protein drinks and a minimum of 4 to 8 ounces every hour. Protein drinks at this point do not need to be clear. Your IV line and drain will be removed prior to discharge. And gastric bypass and duodenal switch, if you're doing well, will go home on the 3rd day after 2 nights. Once again, the key to discharge is making sure you're drinking enough fluid, a minimum of 48 ounces, but a goal of 64. Your protein goal is between 60 to 70 ounces per day, minimum 30 to 40. Start your multivitamin B12 once you're home. Pain medications may be given. Nausea patches and medications as needed, and activity and walking. Most patients go home at least that night with oxygen, but sometimes they don't need it. So don't worry, this isn't long term. If you require oxygen, this will be set up with your insurance company. Nighttime oxygen will be retested in 3 to 4 weeks to assess if you still need that. And your surgeon's office will order this. If you need daytime oxygen, your surgeon's office will recheck you at your first appointment. Oxygen's not a bad thing as it can help you heal faster. Post-op, we want to make sure that you're supported, so 1 to 2 weeks, first post-op surgical office visit is scheduled. Then you're encouraged to make sure you're attending those nutrition classes at 1 week, 3 weeks, 6 weeks. Also, you can review your newsletter and your handouts. For pain management, you'll be given a prescription for pain and nausea, and you'll start to want to wean yourself off of those. Once again, you can take Tylenol if needed. Your diet progression after surgery. Diet discharge through the first week of post-op is fluids only. Unlimited fluids, once again, a minimum of 4 ounces per hour. Water, low-calorie, no-calorie fluids, protein drinks and shakes, decaf tea, decaf coffee, sugar-free popsicles are all encouraged. After that point, 1 week out after surgery, you'll be focused on doing 1 ounce of pre-selected proteins every 2 hours. And this is continued up until 3 weeks after surgery. So from day 7 to day 21, you can do things like low-fat refried beans or other pureed beans, low-fat small curd, cottage cheese or ricotta cheese, egg beaters or egg whites, light and low-carb yogurt that is Greek with no fruit in it, and sugar-free puddings. On day 21 to 6 weeks out after surgery, you'll be advancing your diet 1 to 3 ounces max every 2 to 3 hours to soft, pureed, flaky foods that are easy to chew. Nothing crunchy, nothing spicy, nothing that has to be cut with a knife. Once again, protein being the focus. So things like tuna, soft fish, pureed proteins that are easy to chew are encouraged. And at 6 weeks and on, you'll be on the solid food diet. And this is where we really want you to adhere to the rules of the tool, and you can start focusing on your diet, exercise, tools, and behaviors. Now you're primarily eating that 75% protein and 25% complex carbohydrates, small bites, chewing well, and making sure you stop before you're full. Also adding fiber.